You are watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, new treatment options for people that have sleep apnea. And if you or someone you love are a chronic snorer, then you have to hear what Dr. Rose has to say. Dr. Rose, welcome to the program.
Thank you for having me. I'm excited to be here.
Good. Now, we should begin with you're a dentist.
I am a dentist,
yes. But this is all you do, is treat people with sleep apnea and chronic snoring. Is that correct?
Correct. My practice is 100% dedicated to treating snoring and sleep apnea patients. A lot of my sleep apnea patients do snore. Now, you don't have to snore to have sleep apnea, but it is definitely a strong indicator that you have sleep apnea if you snore.
Does snoring, like if somebody's a chronic snorer, or they've been told by their loved one or whatever that they, really loud snore, does it lead to sleep apnea or not always?
Not always, not always. But again, like I said, it's a strong indicator, but I have so many stories about patients who their wives are calling or their bed partner sets their appointment and literally says, "You've got to help me. My bed partner is snoring so loud that I cannot sleep." And it's a big push for them to come into my office.
They say this on the telephone.
Oh, yes. Oh, yes.
I asked you, you said 50% of the people that call are the spouse.
Oh, definitely.
The call, and usually the wives.
It's usually the wives.
What do they say on the phone? You say that they
they say a lot of things. They give us sometimes too much information, but we love it. We love getting all this, extracting all this information, because it's important to get everything, the background, the history, as much as we can prior to the patient coming in. But they do say, "How can you help me? I am not sleeping anymore. I need my husband to come in. I'm worried he stops breathing. I'm witnessing these apneic events where he's gasping for air. He just literally stops breathing. And I don't even know if he's gonna die when I'm laying right next to him." So they call, and we're their hope. We're their hope that, that we're gonna be able to help them. And we're able to.
Okay, let's talk about sleep apnea in just a moment, but snoring. You said snoring is easy for me. To get rid of snoring is easy for you.
Yes.
Really?
Yes, oral appliances, they are actually extremely effective for treating snoring. Snoring is the easiest part of my job to treat. I look more into treating the apnea, the disease, the severity of the apnea, but snoring, and most of the patients are affected by the snoring, and that's what they come in for. That's the chief complaint. I'm snoring, I'm waking myself up, I'm waking my bed partner up. It's not always the wives, it could be the husband. And they'll come in, and that's what they want treated.
Now, with CPAP, that is, I guess, the gold standard for taking care of these people.
Absolutely.
You say that you have people, many people, maybe over 100 people or hundreds, that were on CPAP, that you were able to take them off CPAP with your custom-made appliance therapy, and it works.
Indeed.
It does work?
It does. I have patients who literally, this morning, right before I came here, I have my patient who came in. He was at our office, and he just basically said to me, he looked me in the eye and he said, "It's amazing that this little compact, efficient little oral device that you put in your mouth before you go to bed, it really works. It works. I'm not waking up in the middle of the night. I'm not having to go to the bathroom 6 or 7 times in the middle of the night. My wife's not nudging me. I'm actually being able to sleep. Not only can my wife sleep, but I can sleep." I mean, this is literally what I listen to every day, and this is why we do what we do.
So you work with medical doctors that send you some patients?
Oh yeah, we have literally 90% of my practice is referral based, meaning coming from medical doctors and sleep physicians.
Because insurance covers it. I mean, if you have a PPO, insurance covers it. You'll work with HMOs to get the coverage. Medicare covers this. Is that right?
Yes, Medicare covers it completely. As long as you have the secondary supplemental insurance, Medicare covers it.
Okay.
Medicare covers it themselves, but it's 100% covered with secondary supplemental. The majority of medical insurances cover it, PPOs we're talking, and literally very few do not cover.
All right.
Durable medical
And you have an
equipment.
insurance department right there on site?
Yes, I have my own dedicated medical biller who is focused just on doing the medical billing, helping the patients out. And we're very good at maximizing our patients' insurance so that they can get the most out of their benefits.
Okay, good. Now, help me understand the way this works. And for people just tuning in, we're talking about a new treatment option for people that are wearing a CPAP, that have sleep apnea, or the chronic snoring crowd.
Right.
They breathe all right during the day. Is that correct? So they're breathing
yeah.
okay. It's only when they lay down, fall asleep, what is it? Their jaw is what? Fading
Right.
back?
So when they're sleeping, and literally you're sleeping typically supine, meaning on your back. Some people can still sleep on their side, but what happens is you sleep on your back or even on your side, and this can still happen. The soft tissues, the muscle, the tongue, your jaw falls back, your tongue is attached to your jaw, and all of that, all of this soft tissue is falling back, obstructing the airway, and that is why we're getting obstruction. And so when that happens, obviously less oxygen comes to your organs, your organs aren't working at the proper function, you're repeatedly getting woken up at night because you're not getting the oxygen. And if you can imagine getting woken up repeatedly with all these arousals because you're not getting the oxygen that your vital organs need, it's fragmenting your sleep. You wake up, you're extremely tired.
Is that right? They're tired when they get up?
The majority of my patients, the one thing that they all they have in common and share is that they're really tired. They're suffering, they're tired. And so when they wake up, they have this grogginess, it's hard to function. A lot of them have to have caffeine in the morning, like triple doses, quadruple doses of caffeine. You know, it's a process. It's literally a process to have to get up. And for these patients that I've mentioned, I have story after story after story, after we've treated them with an oral appliance, a complete reversal. They have more energy, they're waking up with lots of energy and less grogginess. Their life has totally changed. They have more energy, less fatigue. They're taking on more tasks. They pick up tennis. They're actually playing tennis. They're picking up more sports. I have a patient who's actually doing more mind games, like playing chess, because their mind's more alert. His memory is coming back to him, and so he's able to concentrate more during the day, and he's more alert. And so I get these stories all the time.
I guess everybody knows. I mean, anybody that's watching this, if you don't sleep very well that night, right, the next day you feel lousy.
Oh, we all
your
feel
ambition,
that.
Your drive, your assertiveness,
Right.
your get up and go, motivation.
If you don't have sleep, you have nothing.
So these people, and I'm asking the question. People need to know. I'm not endorsing you. I'm just asking the questions here. But so these people with the apnea patients, they think they're sleeping, but they're waking up like 30 or 40 times in an hour.
Right.
Is that true? Is that right?
Yes. I mean, I have patients who literally are waking up between 5 to 30 or even more per hour, every hour while they're sleeping. I have some patients who actually it's rated by index. So when we're saying 5:30, I have some patients who are over, like a few that are over 100, who are severe sleep apnea.
So they're waking up like 100 times a night.
They're waking up over 100 times a night. We put them into an oral appliance, and we've gotten that number to a stable condition. And it's dramatically
And what does good mean? I
changed
mean,
their life.
like for example, somebody that's waking up 30 times a night, right? They don't even know it, right?
Right.
What are some of the numbers? I guess scientifically you test the numbers.
Correct. So 0 to 5 is normal apnea level.
Okay.
So they can still have apnea, but it's considered normal. 5 to 15 is mild sleep apnea. 15 to 30 is moderate. 30 or greater is severe, meaning 30 times or more per hour, they stop breathing for 10 seconds or longer.
Wow.
They stop and start breathing cyclically. It's repetitive all night long. So I have a patient who I just saw a couple weeks ago. He came in, and initially his AHI number, he was severe, over 30, 33.8. And we saw him most recently, and his number is down to 6.8, which is very tolerable. I mean, this is a game changer. This is literally after one follow-up. He's happy, he's active, has less fatigue,
because he's
more
sleeping
energy,
again.
because he's sleeping. Yeah, I mean, you can't.
And this isn't
put a
just
price
for
on
overweight people. You say that thin people
No.
could get this too, is that right?
Right. So it used to be the obese over 50-year-old male disease. And although men are twice as more likely than women to have sleep apnea, I treat a ton of patients. I treat patients who are young, I treat patients who are women, I treat patients who are lean and don't have the overweight issue. Their BMI is normal. So they come in, they see me, and they have a retruded jaw. We call it retrognathic. It's retruded, it's pushed back, but they have a lot of soft tissue here, pharyngeal tissue, meaning tonsillar area, adenoid area, soft palate, all of it's hanging. And I see a lot of these patients, they don't have to be old, they don't have to be male, they don't have to be obese, but they're skinny, tall people who literally are born genetically with a predisposition for sleep apnea.
And it can be fixed.
And it can be fixed.
CPAP, you do get an immediate response, but the equipment is so bulky and noisy, and you just have to kind of switch off your life while you're dealing with this machine. And you know, your partner is also affected by the noise and the look of the equipment. They wake up in the night and see you in this mask, whereas the mouthpiece, it's, you know, it's just in your mouth, and it doesn't affect much as far as you can roll over, do anything you want. Almost immediately I noticed that I was sleeping better, getting more and more energy over time.
I snore very loud. My poor wife wears earplugs every night for 20 years. I used to have a CPAP machine before and hated that. So I heard about Dr. Rose on the radio and decided that that was something I'd like to try. And so I went in. It was a great, easy appointment, and they fit you for this oral device. It looks like a mouth guard that you'd wear in sports.
Able to do more. I enjoy hiking and biking, so intimacy with my wife and so on and so forth. So it just kept getting better and better.
I wasn't really sure if it was going to work or not, but it's worked fantastic. It's completely stopped my snoring. So it's been great. And so I have, you know, a lot more energy during the day, and of course, you know, my wife loves it because she doesn't have to wear earplugs anymore.
One of the things they notice is that you start noticing dreaming, that you're actually getting more vivid dreams, and I guess that's part of that getting the good quality rest to the point where your mind can kind of expand and start dreaming. So to me, that's been amazing to see that happen.
This is simple and easy. You can take it with you when you travel. It's a simple little device, and it works great.
So when we say words like no more CPAP, things like that, would you say that once a week somebody in your office is no longer wearing CPAP?
I would even say more than once a week, but we get a lot of patients that are CPAP intolerant, and they come
What does
into
that
our
mean?
office.
They just don't like CPAP?
They don't like CPAP. Well, who likes CPAP?
Okay.
Does anyone like CPAP?
I don't know.
I mean,
Doesn't sound good.
they don't like CPAP. Well, they some of them tolerate it, meaning some of them will wear it because they're regimen, they're compliant. I have patients who are compliant, like military people. But then I have patients who, they're not going to wear it. They've got a mind of their own, and it's not part of their lifestyle. I've got young and old adults who are now dating. I have young people who are dating. Can you picture them putting a CPAP mask, you know, right after they've met their new bed partner, and putting it on before they go to bed? It's not part of their lifstyle.
That sounds terrible.
No, and so I also have people, older people who are dating. They might be widowed. Now they're dating, and they don't want to be wearing a CPAP. CPAP is great. CPAP is effective.
So it works.
It works. However, the caveat is it works when you wear it. And a lot of patients are not compliant. A lot of patients cannot tolerate that mask.
Is this a big problem in San Diego, by the way? I mean, this seems like a healthy group of people.
It's a big problem.
I mean, are there like tens of thousands of people?
There's tens of thousands, and I would say that because
Really?
Yes, because 2 to 4% of the entire population is affected by sleep apnea. There's 18 million people affected by sleep apnea. 2% are women, 4% in general are male. And so if we take that number, you can grasp tens of thousands of people in San Diego alone that are affected by sleep apnea.
Okay,
So
and you're going to wipe it out here in San Diego? Is that your goal?
I love to help people one appliance at a time.
So there are people that are suffering, meaning they're lethargic all day. Maybe they're sleeping in 2 different rooms. and because they refuse to wear their CPAP, or they're in denial about it, won't even go to a sleep doctor,
Right.
that you're saying, and I don't want to put words in your mouth, but they
Right.
could go to you see this all the time, you custom fit an appliance that they sleep with, their snoring goes away many times, right? And their apnea is gone.
Typically, the snoring does go away, yes, and the apnea is in a stable condition, yes.
You told me on the consult in our green room that, because I asked you, what do they ask on these consults every time? And you said they always want to know, doctor, does it really
Does
work?
it work? Yes.
And is it going to work for me? So how do you know with predictability?
Well, with predictability, there is no predictive measure to know whether anyone is going to be responsive. And that's the same thing with if you go in for cardiac surgery or you can accept that heart transplant.
Okay.
You know, you don't know how your body's going to react, but time and time again, we see this work. It's kind of a running joke with some of our forums. These appliances
Online
work.
forums
Yeah,
with
online
other
forums
doctors,
with other
other
dentists, that these always seem to work.
But the chronic snoring, because the chronic snoring crowd, if they're watching this, the wives, you can pretty much wipe out the snoring. You say that's an easy one.
The snoring's like the easiest thing.
Why
to
wouldn't
treat.
any guy want to do that?
I don't know. I
It's
love
covered
it.
by insurance,
I love
too.
it when patients come in and their chief complaint is my snoring. I get this
That's
a lot.
an easy one
They
for
come
you.
in, I'm snoring, my wife's waking me up, can you help me? Or the wife calls, he's snoring, he's waking us up, both of us, and himself up, can you help us? Because neither one of us are getting any sleep. It reminds me of this story I had literally a couple months ago. The husband and wife, they're newlyweds. Husband was on CPAP, and they're actually from out of state now. They moved. Husband was on CPAP for a long time. We made him an oral device, fabricated a custom-made oral device. He started to wear it, and they had to call me because they're not local. And both of them got on the phone. And it was great because she said, I love it. He's not taking his hose off, the CPAP. He is not waking me up. She was the one who made the appointment. And we're both getting sleep. And I'm not hearing him gasp for breath. So I know he's sleeping better and he's not snoring. And then he said the same thing. I'm waking up. I'm actually cycling to work, which is several miles away. And he's got more energy. He's feeling great. It's a life changer. I have another patient who came and saw me. And I remember the first time she came in, her first original appointment, she had nothing but 2 words to say to me. She literally had nothing to say. She looked tired. She didn't even want to be there. You can tell her body language said, I don't want to be here. But she was there. And
Was she referred to you?
she was referred to us again by a sleep physician, pulmonology.
Okay.
And we treated her, fabricated her device. A couple follow-up visits later, because follow-up is important, we see her and she has this huge smile from ear to ear. And I'm wondering what was the change? I'm wondering, okay, did you get married, or what was the turning point? And so I interviewed her when I was talking to her during the office visit, and she said, I am not having to drink 5 cups of coffee in the morning anymore. I'm not drinking any coffee this morning. She said, I did not have to get up in the middle of the night. Instead of 5 times, she maybe got up once or twice, which is a huge improvement. She's feeling good, and she's doing more active things. I like to ask them, what are you doing differently now that's giving you more energy that you weren't doing before? I like to ask him, can you give me 1 or 2 things? And I remember she was saying, well, I'm doing gardening. I didn't like to go outside. Now I'm more on the outdoorsy.
Nice.
Yeah, she's enjoying life.
Now, you believe you get better results than most because this is all you do.
So I'm not busy having to do an exam in the hygiene room. I'm not worried about doing a veneer. I'm not worried about having to worry about pulling a tooth in the next room. I'm just focused on my patient and treating their sleep disordered breathing.
But still, I'm not clear on why you're getting better results because of that. Just because you have more time with the patients?
No, so we're not just giving them the appliance and then saying goodbye. I mean, we have to bring them back in. We do a lot of follow-up. We want to make sure that the patient is getting the treatment that they need.
So
that
you have to adjust it?
We do. We have to adjust it.
So they have to like tweak it out? Like some people
Yes.
need more?
So, it's by small increments, and then we want to make sure that the adjustment is made properly, because the patient could maybe adjust it incorrectly, or we'll have them come back because we want to make sure that when we're testing them with possibly a home sleep study with the appliance to test for efficacy, to make sure that the appliance is working, that the patient not only has stopped snoring, we get that a lot, but that the apnea has been controlled to a stable level. Because patients will come back in and they'll say, oh, I'm not snoring, I don't need to come in. Yes, you do need to come in.
So they're concerned with the snoring.
They're concerned with the snoring.
Which is good for their partner.
Which is great. But I'm concerned about treating the apnea as well.
So they don't have a heart attack or whatever.
Correct, because we don't want to create a silent apneic, meaning the patient says, I'm not snoring anymore,
so
I'm cured. Which we need to make sure that you're as stable. I hate to say cured, because literally it's a stable condition. You still have sleep apnea, you just have it when you're sleeping. But you won't have sleep apnea if you're wearing your appliance and it's working.
So there's a lot of adjustments.
There's several follow-up visits that we need to do, that we require for patients to come back so that we can tweak it. It's not, sometimes it's great, it's perfect where they want to be, but we need to do the follow-up.
I was snoring, and I think that was my biggest sadness in my life for over 40 years, was that I was, snoring, not able to sleep with my husband. With the appliance now, geez, it's easy to use. I rinse it off, I put it in my mouth, and I go to sleep at night. And now it's so exciting because I don't wake up in the middle of the night. I wake up, I'm refreshed.
My snoring was not only disturbing me, it was also disturbing my wife. Clearly, I'm sleeping better. I'm sleeping through the night, which is a wonderful thing. The second thing is that I'm also sleeping with my wife now, which is a wonderful thing.
Was snoring so bad that basically my wife couldn't get me sleep at night. Got the appropriate dental device for me and went from moderate to severe to light sleep apnea with almost no snoring. I sleep soundly through the night, so does my wife, everybody's happy. I would definitely say that I feel much more rested now than I did before. Before I didn't even realize how tired I was until I was getting good sleep every day.
I can now stay awake at staff meetings, or I can watch a movie without falling asleep. There's nothing out there easier. I mean, you can do surgery, but that's painful. This device has no side effects.
It is definitely easy to wear. It is a very snug fit.
If you have a bed partner and snoring is part of your sleep apnea, go do this immediately. It will not only will you sleep better at night and have more energy, but it will actually improve the overall relationship with your sleep partner.
Have you ever had somebody with sleep apnea that had a 100% reversal?
Oh, we see that all the time. I've had patients who were on CPAP, thought that they would have an appliance made to use combination therapy, and we'll work with CPAP to lower the pressure on CPAP, and they ended up just loving their device so much that they just quit their CPAP, and now it's in their closet.
So nobody wants CPAP?
I don't know anyone who wants CPAP.
Because I don't know of anybody that's wearing a CPAP. So there's a world out there, there's people here in San Diego that are wearing CPAP, right?
Oh, yes.
So let's agree that it works,
it's
they
effective
feel better
for them.
because of it. If there was a better way, they would do it. You're saying that and many of these people have not ever attempted an appliance therapy like this.
Right, a lot of people don't even know about it.
So go in for a consultation and find out your options.
Yeah, exactly.
So insurance covers it, PPO for sure, Medicare, is that right? If you have a supplemental program, covers 100% of it. You'll work with HMOs.
Yeah, we work, and we'll do whatever we can for the patients. We'll work hard and try and do whatever we can to get their HMO to cover it.
Now, we've had medical doctors on this program, and in the world of integrative functional medicine, they place a huge importance on sleep. That if you're not sleeping, you're not restoring your neurotransmitters.
Right.
You're stressed out, you don't even know it, with cortisol. You can't lose weight with all of these stress hormones in your body.
Right.
And that when you get somebody sleeping 6 or 8 hours, the stress hormones lower, you feel better, you wake up refreshed, you have more energy.
The hormone levels are good.
Yeah, you're more engaged in life. So if you're not breathing, you're not oxygenating, or what?
If you're not breathing, your organs aren't getting the oxygen that you need, you're not getting the restorative sleep that you need, which affects your memory, which affects a day-to-day function. You're less productive at work. Your untreated sleep apnea can cause a lot of things. It can cause worsen cardiovascular disease, hypertension. There's a list of things. Memory loss goes on.
So when you get people back to sleep, they start feeling better.
They start feeling better.
Obviously.
But we give them their confidence back too.
Okay.
They've become a new person. It's amazing what sleep can do for somebody.
You've treated your own family, I think you said.
I did. I treated very close family. My father and my mother. So my father and my mother both have severe sleep apnea. And
Interesting.
yeah, and it was I thought my dad was pretty bad, but my mom outsnored my dad by a long shot. So when I decided to make her an oral device with the blessing of her cardiologist, she couldn't believe, neither could my dad, that we got her nearly silent. I mean, it was just, I remember renting a room with her because we went on she's a physician, and we rented a room in Vegas with her, and she literally was snoring so loud, I almost had to get my own room. And I didn't, but I just thought, I have to do something.
So how fast did it work for her, by the way?
Oh, immediately. With her, it was literally like the first night. It was
so
just...
a life of snoring, 10, 20 years, to being gone.
Yes.
And is that typical? It's common?
It's very, very common. It's very common.
And what does she say as far as energy, things like that?
She says she's not getting up in the middle of the night. You know, she's older, so a lot of my patients who are older, you know, they have nocturia. They have to urinate in the middle of the night numerous times. She's not getting up in the middle of the night. And
so she's a medical doctor. Doesn't she say, you need to go on the news about this? You need to have a press conference about this.
She does. She says, you need to take time out of your schedule, your busy schedule, stop treating patients and actually spread the word. So that's why I'm here.
Good, good. We're out of time. I want to thank you for coming on the show. Final message, though, to somebody watching this, and like you say, they're still skeptical, right? I don't know if this is going to work for me. It sounds too simple or whatever. What do you say to them?
I would say to them, come to our office. Let's meet. Let's talk. Let's have a discussion. And at least know your options, because there are alternatives out there. And we can help you. Okay, good. I want to thank you for coming on the show again. And insurance questions, they can call your office. You can give them an idea of what's covered, what's not covered. Definitely.
All right, thanks again.
Thanks a lot, Randy.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.